Welcome everyone to another episode of Coffee with ESPU Research Committee series. Today I have Luke Harper, previous chair of the ESPU Research Committee and recently elected ESPU Board Member. Welcome, Luke.
Thank you. I'm very happy to be here. Very happy to have this fantastic coffee with you.
Great, perfect. So, Luke, I would like you to introduce yourself to people, and I would like to know your career roads. What have you gone through? Just tell us a little bit of yourself, please.
Okay, well, it's actually quite a bit of a long story, but so I actually started doing medical school in Brussels in Belgium, because that's where I was living with my parents, who were both British but working for an American company. So I did medicine in Belgium and started doing general surgery in Belgium. And then as soon as I interacted with pediatric patients, I suddenly thought this is exactly what I want to do. The relationship with pediatric patients and the pathologies. So I decided I wanted to do pediatric surgery, so I sort of shifted towards pediatric surgery and then decided I wanted to do more, I would say, high-level training, which meant that I actually moved to finish my training in pediatric surgery in France. Worked in the Réunion Island and Bordeaux, and then spent 9 years in Réunion, and then I've been back for 10 years in Bordeaux, Children's Hospital.
Perfect.
Pellegrin.
And how did you get along with research from the beginning of your career, or there was some incident that pushed you to research? Please tell us the story of your research career as well.
Well, it's I guess one of my when I was what we call an intern, so it's during the specialization. One of my semesters was in orthopedic adult surgery, and the orthopedic surgeon asked me to write a case report. That's what I started with, and it was a case report. But he said, I trust you to write this up, and it meant that I had to look through the literature and then understand what was being done. And that, even if it's not true research, the actual work it asked meant that I had to start asking questions and finding answers. And then I found it quite exciting. And then at the end, when you submit the paper and then it's accepted, that was really exciting. And that was probably one of the first things. And then from then on, every time somebody would ask a question, we'd have a discussion. And especially because of the fact that I've actually moved from different hospitals, and you realize that in some place people, they're always doing the same thing, and in another hospital they do it differently. But it seems like all the patients are doing well in both hospitals. So does this difference have an importance or not? Some things nobody questions, some people, everybody questions. And then it became a habit that anytime somebody would ask me about something, I'd try and figure out if this question had actually been answered in a truly scientific way.
Do you also believe in challenging the dogma?
Well, yeah, I mean, because actually the dogma is, for me, the dogma is something which is basically you think that it has been around for so long that it has to have a solid background, a solid scientific background. And it's amazing the number of dogmas which do not have any solid background, and that people say, and then you say, so why did you do that? And he says, well, this is what I was taught to do by my mentor, my predecessor, who himself learned it from his predecessor, and it's been going on for 200, 500 years. And then you realize that some of these dogmas, the problem is actually they are, and they probably had a very good reason to be there at a certain time, but medicine has changed, we have changed, what we use our instruments have changed, and therefore, the idea is not to say that a dogma is bad or that it was not good at one point in time, but it's to say that maybe what it was resting on is no longer true. And therefore, they should always be challenged, yes.
I agree. So, like, speaking of challenging the dogma and asking proper questions, you have done you have organized a wonderful national multi-institutional study, which is a circuit trial. And as the previous chair of the ESPU Research Committee, you organized the sci-fi study, which has been a very, very important step in whole pediatric urology literature, because it included like just a little bit more than 3,000 patients, which was immense. Can you please tell us the obstacles that you faced with during the both national, multi-institutional and international ones?
Yeah, okay, that's a great question. First of all, whether it is circuit or sci-fi, it's teamwork to start with. I mean, the sci-fi trial is definitely the first trial of the whole research committee, but it was really a great team effort. The problem is, I mean, as you know, pediatric pathologies are rare, so in just one institution, it's difficult to have sufficient patients. So we have to learn to work together in multicentric studies. Now, when we did the circuit trial, I would say that one of the main problems was the standardization of care. And that was actually interesting, because when you start trying to standardize, you go back to these dogmas again about what people were doing, and they're saying, we never did it that way. And sometimes you can just write down a few new questions that arise from the fact that you're trying to standardize, but standardizing means you've got to actually try and get everybody to do the same thing, also accept the fact that you might have to do things differently if the majority of other centers you're going to work with do it differently. I mean, you can't just walk in and say, this is what everybody has to do. So it's a discussion, but as standardization is quite difficult. But I would say it's the clinical aspects which were difficult. When it actually was the sci-fi trial, I'd say that what then became more problematic was not the standardization, because we were actually
standardization was not the issue at the south.
Yeah, but it wasn't the exact issue, and the way the trial was, we didn't need to go through the step of standardization, and that was a good thing. But then it was all the regulatory aspects, and I mean, obviously every country has ethical guidance, and that is essential, and it's there to protect patients and to protect data. But the way all these institutions have written down their regulatory aspects means that just one document which you try and get everybody to sign, they all want their different versions. You've got to rewrite it for everybody, and then there's interpretation about what is, for instance, for sci-fi, how anonymized is the data? Okay, if there's no name, no age, no nothing, is this sufficient or not? So that did take a lot of time, and I think that if we wanted to be even more ambitious and then go for something like would be prospective and a randomized trial, that would be the main problem. And maybe if you had some kind of international agency that could take up the responsibility for the ethical, which would be above national guidelines. Now, I know that in reality, national guidelines, they're always above everything which is international. But I mean, we talk about the ESPU, Europe and everything. I mean, imagine you'd be able to have something international which could say, we have checked the ethics and we are giving validation which covers every country, every institution that wants to participate.
Yeah, exemption of...
That would be fantastic, because the most difficult, and there's something paradoxical in the fact that getting approval, ethical approval, is difficult, which means that some studies cannot be performed, which means that we do not have data, which means that we are treating patients with insufficient data, which cannot be ethical. So
like a vicious circle.
that's what's paradoxical. Doing research is trying to answer questions and to improve the care we are giving. I mean, you cannot get much more ethical than that in how you want to go about doing your job as a surgeon.
Yeah, like that's one of the many obstacles that has been facing with all the scientific people who are doing research. But I think, as you mentioned, like a headquarter of some sort might be very beneficial, doing better research, easier and reproducible for the goodness of all people around. So lastly, I would like to ask you to give a couple of pieces of advice for young researchers or young people on their early steps of their careers. Why do they be interested in research?
Well, I mean, for me, it's fairly easy. I mean, first, I think that research, asking questions and continue trying to improve the way we work is something which means that our clinical work is improving. Research is stimulating for the mind, and it also means that first you get to meet people who have different jobs than yours. I mean, you're talking to a methodologist, to a statistician, you're talking to other colleagues, and that is fantastic, meeting people who are doing something else than just pediatric urology. It also means that, I mean, we have our clinical work, which is very important, but when we go to conferences, we actually share what we've been doing in our research. And some of the best moments in my career have been through meeting fellow researchers. They've been through working within the research committee of the ESPU. Have been some of the most fantastic moments of my career. And I mean, just to give an example, you were talking about the CIRCUP trial. In 2014, I went for, I got a grant to visit a few centers in the US, and I spent a few weeks visiting Boston Children's Hospital in 2014, and I was just starting really in the research. I was there as an observer, and then a few years later, the CIRCUP trial was published, and I was actually invited for one of their scientific sessions, as the main author of a trial. And it was really funny for me to a few years later, to be actually invited by the Boston Children's Hospital for this discussion about some of the research, when a few years previously I was the observer with the little badge, so humble to be there. But so getting to meet people from other areas of medical care, but also from other cities, countries, that has been absolutely fantastic. So, research is just an opportunity to grow really.
Yeah, thank you very much, Luke. Thank you very much for sharing all your all these informations that are very vital for people out there.
Thank you.
So this is the end of another episode of Coffee with ESPU Research Committee series. I hope you liked our conversation. We are looking forward to meet you in another episode. Thank you and bye-bye.